So, the easiest way to remember when you wash your hands, you're only going to, and that's basically, they're testing you off on it. So after your first skill, you're gonna physically wash your hands, okay? After the first skill, you're gonna physically, that's the only time that you're gonna physically wash your hands. Okay, remember I said if you fail that, they're not gonna let you go on to do your other skills. So after your first skill, you physically wash your hands. All the other times, you're gonna sanitize in, sanitize out. So when we first start the skill, we'll sanitize in. When you're done with that first skill, you're gonna physically wash your hands. There are 4 skills, 4 mandatory skills. So if you looked at your paper, on the top where it says perineal care for female, catheter care, bedpan, and PPE with entry of the urinary catheter, it's gonna say mandatory first. That means out of those 4 skills, one of those 4 skills are for sure going to be your first skill. And those are hand washing skills. So anything that has to do with cleaning the vaginal, the genital area, or anything with urine, those would be one of the first skills. Okay? And you'll know as we go through it, but so for us training in here, you're gonna need to know when to wash your hands, okay? Because it's not gonna be always your first skill in here practicing. So you just need to know the skills that you're supposed to wash your hands. But on state testing day, just know that after that first skill they give me, I am going to physically wash my hands. Okay? Yes? Alright, so the first skill I'm gonna do is perineal care of an incontinent female. So all of the steps, whatever steps not on there, you just write them in, okay? Because this is like, all they do is just, this is generic, basically, right? So for Texas, they'll just put Texas on the front. For Georgia, they'll just put Georgia on the front, right? So, and like I said, each state has different, the way they do different things. So just make sure that you're writing it in and reporting. So did everybody find perineal care for incontinent female? Does anyone need a stapler? Yeah.
It's page 17, McKenna.
As you see me do it, okay? Alright. I just want you to look at the cheat sheet. Yep, so there is a cheat sheet on there.
Where?
That lets you know that you haven't been watching or looking at your stuff on Google. There's 4 of those 4 mandatory skills for sure are on there, and it has exactly like each step that you do. So, you're gonna knock, sanitize. Hi, Miss Sarah. My name is Natasha. I'm gonna be your nursing assistant today. I'm here to do some peri care on you. Is that okay? And you always have to ask, is that okay? She says yes. Okay, well, here's your call light while I get my supplies. I'm gonna go ahead and lock my brakes at the top and the bottom, and then I'll be right back. I am going to close my curtain. Okay. Every skill, except for feeding a resident, has to have a protector on there, a barrier. So you need you'll need 2 barriers. One will go underneath your resident's buttocks. You're gonna roll it the long way. You can't hold this up against your clothing. You are going to need basin, soap, 4 washcloths, 1 big towel, You're gonna need, a privacy blanket. And you're gonna need some gloves. You cannot raise this bed until you have everything that you need. You have to talk to, the person and let them know what you're doing the entire time. Okay, Miss Sarah, I'm gonna go and get you some water, then I'll be right back. So on test day, you'll physically walk over there, grab a paper towel, turn the faucet on with that paper towel. You're gonna test the water with your wrist. You're gonna fill this basin up halfway. You're gonna turn it off with that same paper towel and throw it away. Once you do that, you come back over here. Miss Sarah, can you test the water for me, please? It's good. Okay. Now you have everything that you need. You're gonna go ahead and raise your bed. Okay, Miss Sarah, I'm gonna go ahead and raise your bed and get started. You always wanna raise the bed to your hip or to your waist, whatever is comfortable for you. All right, Miss Sarah, I'm gonna go ahead and just remove this coal light. Now that we have everything, we're ready to get started, we're gonna put our gloves on. So remember to put your gloves on right before you touch your resident, unless the skill requires you to do so before. You always unfold, you never shake. Okay, Miss Sarah, I'm gonna go ahead and put this privacy blanket on you. It's just gonna keep you covered while I do this skill. You cannot fan, so remember to always unfold. Once we get that open, we're gonna go ahead and pull down her blankets to the bottom. Okay, Miss Sarah, I'm gonna pull your blankets down to the bottom so they don't get wet past the feet. Now that we have done that, we're going to put the pad up underneath her buttocks. So for this, we do not have to turn her onto her side to put this pad up underneath her. We'll just have her lift her hips. But when we roll her over, she has to have an observer. All right, Miss Sarah, and your pad goes right to where the buttocks start, a little bit past the knee, okay? All right, Miss Sarah, I'm gonna have you lift your hips on the count of 3. 1, 2, 3, and you would just lift her hip a little bit without turning her completely over and roll away from you, okay? You'll cover her back up and walk around to the other side. Okay, Miss Sarah. Same thing, we'll have you lift your hip on the count of 3. 1, 2, 3, and you will just roll that pad over this way. All right, Miss Sarah, I'm gonna go ahead and get started. I'm gonna pull your blanket back. And we want to keep her covered as much as possible, so we're gonna take our big towel. We're gonna fold it in half with the open area going towards the bottom of the bed. We're gonna put this between her legs. So when we dry her, we can pull this up and dry and she'll remain covered, okay? So remember that it's only one basin. Soap never goes in the water, okay? So we do what we call a 4-leaf method. So we'll take our washcloth, we will put it in the basin, rinse it out, squeeze it out. 1, 2, 3, 4. So you have your washcloth, it's in 4s. You have those loose leaves, okay? And you just 1, 2, 3, 4, okay? You're gonna hold this in your non-dominant hand, okay? And so you have to act like you are opening up the meatus, okay? And you have to wipe down the middle with that first leaf, pull it back, wipe down the side of the labia, 2, the other side of the labia, 3, and then right back down the middle again. And then you will toss it And you'll rinse the same way. Middle, side, side, middle. Then we're gonna pat dry. Okay, and then we're gonna pull this back down. And we're gonna need to use this again, so we'll put this over here. So this is when you'll call an observer up, but you're going to move her towards you first. Okay, Miss Sarah, we're gonna scoot you towards me on the count of 3. Hip and shoulder, 1, 2, 3. Okay, and then you will say, okay, I need an observer. The observer come up. I just know how to do her, so she can stay on her side. So just, you can record. All right, so okay, Miss Sarah, we're gonna turn towards the observer on your right. 1, 2, and 3. Okay. All right, and she has to stay covered. Only thing that should be exposed is what needs to be exposed, which will be her buttocks. So same method, we're gonna put the water in here. We'll soak up those 4 leaves, 1, 2, 3, 4. And we're still going from front to back. So first leaf is gonna go up the middle, cheek, cheek, middle. Rinse the same way. Middle, cheek, cheek, and then middle. Then you will pat dry. And you always want to make sure that you're getting rid of your supply as soon as you're done. While she's on her side, we're going to remove the pad. Okay, Miss Sarah, I'm gonna turn you back on your back on the count of 3. 1, 2, and 3. Just gonna move her over a little bit. Then we're gonna walk around and remove the rest of the pad. On the count of 3. 1, 2, 3. And you don't wanna pull, because that's considered shearing. All right, Miss Sarah, we always want to get her together before we take care of our things. All right, so you're going to roll inside, remember, pull, roll, making sure she stays covered, pull. Roll. Make sure that it's rolled away from you. This middle line, this thickness here, lets you know if it's even on each side. All right, Miss Sarah. Is there anything else that I can get for you? No? Okay, well, here's your call out if you need anything. I'm gonna go ahead and warm my bed. Open up my curtains. All right, so now we can take care of our water. We're gonna take our basin back over to the sink, grab a paper towel, turn that faucet on. We're gonna dump that water out. We're gonna rinse, dump, turn that water off with that same paper towel. This is not considered clean, so we'll grab a paper towel to hold it. We're gonna grab a paper towel to dry out the inside, throw it away. Grab a paper towel, dry out the bottom, throw it away. Then we're gonna grab one more paper towel to come back and pick this up. Put that back, throw your paper towels away. In here, unless this gets wet, there's actual toothbrush on there. If you brush someone's teeth or their feet was on there, this goes in the trash. But if not, it's gonna go in your hamper. We're gonna take our gloves off. This is a hand washing skill, so I would physically go over and wash my hands. then you'll say skill complete. Hi, Miss Sarah, my name is Ms. House. I'm gonna be your nursing assistant today. I'm here to do some catheter care on you, is that okay? I'm here to call out if you need anything. I'm gonna go ahead and walk my brakes up to the top, bottom, then I'll be right back. Right. We need the rear for our table. And we want her underneath the person.
You already prep them like that, though?
Huh?
You already supposed to prep them like that?
Then we need our basin, soap, 2 washers instead of 4, 1 big towel, 1 privacy blanket, and our gloves. Well, we don't raise the bed, Wait, Miss Sarah, I'm gonna go get you some water, then I'll be right back. We're gonna go to the sink, grab a paper towel, turn it on, test it with our wrist, fill it up halfway or less. Shut it off, throw it away, come back, have it tested. Miss Sarah, test the water for me, please. That's good. Now that we have everything, we're gonna go ahead and raise our bed. Alright, Miss Sarah, I'm gonna go ahead and raise your bed and get started. I'm gonna go ahead and remove our call light. I'm gonna move a couple fast, so you already know where it works. So we'll put our gloves on. We are going to put our privacy blanket on. Okay, Miss Sarah, we're gonna go ahead and put the privacy blanket on you. Alright, and then we're going to pull her blanket down. Okay, Miss Sarah, we're gonna go ahead and pull your blanket down, keeping you covered. Alright, then we're going to go ahead and put our pad up underneath her. Only exposing what needs to be exposed. Alright, Miss Sarah, I'm gonna have you lift your hips on the count of 3. 1, 2, 3. Just gonna unroll that up underneath her. Cover it back up on the other side. Same thing. Lift your hips. 1, 2, 3. Alright, now we're ready to get started. Okay, Miss Sarah, we're gonna go ahead and get started. I'm gonna put this towel across your legs. And this one, we're gonna be cleaning the catheter. Okay, same thing, water, squeeze it out, soak up each leaf, still with your non-dominant hand. Alright, we're gonna hold at the insertion site and we're gonna wrap this leaf around the Foley catheter. We're gonna wipe down, you're gonna let that go, change the leaf, and we're just gonna do that 4 times. Better when it's real water, right? We're gonna toss that, and we're gonna rinse the same way, 4 leaves. 1, 2, gonna need to wipe it once, dry, pull this down, get rid of this. And this here, I'm gonna go ahead and get your blanket pulled back up on you. Roll, pull. Remember the pad stays underneath there for this one. Alright, Miss Sarah, is there anything else that I can do for you? We'll go ahead and lower your bed. We're gonna open our curtain. We're gonna take this, go to the sink, get a paper towel, turn the faucet on, dump it out, rinse, dump, turn that faucet off, that same paper towel. This is not considered clean, we're gonna grab a paper towel to hold it, paper towel dry off the inside, throw it away, paper towel dry off the bottom, throw it away, paper towel come back and pick this up with, set that in there, throw it away, there's our pad. Throw it away, this is a hand washing skill. I would hand wash, then I would say skill complete. One extra, okay? Hi, Miss Sarah, my name is Natasha, I'm gonna be your nursing assistant today. I'm here to do a bed bath on you, is that okay? Here's your call line if you need anything, we're gonna go ahead and lock my bed at the top and the bottom, and then I'll be right back. Pad for our table. We need basin, soap, we need 4 washcloths. We need 1 big towel. We need a privacy blanket. We need a gown. And we need gloves. Alright, Miss Sarah, I'm gonna go get you some water, then I'll be right back. Gonna go to the sink, grab a paper towel, turn that on, test it with our wrist, fill it up halfway or less, turn off that same paper towel, throw it away. Miss Sarah, can you test the water for me, please? Miss Sarah, test the water. Alright. Now we have everything that we need. We're gonna go ahead and raise the bed. Alright, Miss Sarah, we're gonna go ahead and get started. Remove the call light. Now we can put our gloves on. And put on our privacy blanket. Okay, Miss Sarah, I'm gonna put this privacy blanket on you. Alright, I'm gonna go ahead and pull your blanket down. Alright, Miss Sarah, I'm gonna assist you with sitting up so I can untie your gown, which will be tied. Alright, so on the count of 3, I'm just gonna put my arms right behind her back, her shoulders, and we're gonna sit her up on the count of 3. 1, 2, 3. You're gonna bring her all the way forward, off of you, and then you would just untie the gown. Don't undress her while she's up, just untie it. Alright, Miss Sarah, you're gonna lay that down. 1, 2, 3. Then we're just gonna uncover what needs to be exposed, which is her arm at this time. You're gonna go ahead and push that over to the other side. Go around and take it off. So the first thing we're going to do is we're going to wash her face. Remember, it's just one side, really simple. Of course, in the real world, you'll do both sides. No soap on the face, and we do the 4-leaf method for the face. So we will wet our washcloth, squeeze out. You always want to start with the eye farthest away from you first, okay? So corner out, first leaf, pull it back, corner out, pull it back. Your third leaf is gonna be one side of the face from the forehead down. The fourth leaf is gonna be forehead down on the other side. Then we want to pat dry. There's no soap, no need to rinse. You want to pat dry. Pat, corner out, opposite eye. Pat, corner out, second leaf. Third leaf, pat one side of the face. Fourth leaf, pat the other side of the face. All right, so we're gonna move on to washing the arm. You're gonna place a towel up underneath her arm. You're gonna spread it out completely. All right, Miss Sarah, I'm gonna have you lift your arm for me, please. And it's one direction. You do not go back up, okay? So this is not a leaf method. We're gonna wet our washcloth. Squeeze some of it out, put some soap on there. And we're gonna start from the shoulder down. One direction, we do not go back up. We're going to wash our hand, our fingers. One direction, we're gonna come down, wash our hand, wash the back of the arm, and then underneath the armpit. Toss, and we're gonna rinse the same way. Shoulder down, do not go back up. Hand, fingers, come over, same thing, back of the arm, armpit. You're going to dry that arm. And we're going to put her down over. Come from the outside in. And we want to just tuck that underneath the gown, under the blanket. And then we'll go around and put the sleeve, her arm in the sleeve. Hi, Miss Sarah, can I assist you with sitting up? So I'll put my hand behind her shoulders, her back. On a count of 3, 1, 2, 3. Push her all the way up off of you, because she is heavy. And we're just going to tie her down. And we're going to lay her back. 1, 2, 3. All right, Miss Sarah, we're all done. You're gonna go ahead and pull your blanket back up on you. And we're just gonna roll, pull. Roll, pull. All right, Miss Sarah, is there anything else I can do for you? All right, here's your call out if you need anything. I'm gonna go ahead and let your bed down. I'm gonna open up the curtain. All right, you wanna go empty this. Go to the sink, turn on your faucet, dump, rinse, dump, turn off that same paper towel, grab a paper towel, hold it. Paper towel dry the inside, throw it away, paper towel dry the outside, throw it away, grab one more paper towel, come and pick this back up with. You're Bring my paper towels. Bring the barrier. This is not a hand washing skill. I will sanitize out. My skill is complete. Any questions about that? Alright, so let's start. We want to always sanitize first. We're gonna put on our gown, unfold it, so it's inside out. Okay, so the first thing you'll do is unfold it, put your arms in. Right, and you want to tie at the top first. And then you're gonna tie at the bottom. Okay, you have to make sure it is tied. Then we're gonna put our gloves on. So tie at the top, tie at the bottom, put your gloves on, and you must state that your gloves are over your sleeve, even if they don't stay.
Bless you. Thank you.
Gloves are over my sleeves. Now that you have that on, you want to knot. Hi, Miss Sarah. My name is Natasha. I'm gonna be your nurse assistant today. I'm here to empty your catheter. Is that okay? Alright, well, here's your call light if you need anything. I'm gonna go ahead and lock my brakes at the top and the bottom, and I'll be right back. You're gonna get your pad and bring it straight to the floor. And you're gonna get your cylinder, and you're going to get an alcohol wipe. You're gonna open up your alcohol wipe and just set it on top of the paper. And then we're going to raise the bed up so that the end of the folio doesn't touch around the cylinder. And Sarah, I'm just gonna let your bed up a little bit here. Just wanna make sure that the cord isn't kinked or anything. On here, there are two clips that you just push together and pull out. There's a silver clip here that you just click up with your nail. And it opens it up. It'll tell you when to stop. Okay. Then you'll take your alcohol pad and you're just gonna clean the end of that. Put it back in. Get rid of this. I'm gonna move this back some so it doesn't waste when we let the bed down. All right, Miss Sarah, I'm gonna go ahead and let the bed back down. Is there anything else I can do for you? No? All right, your call light is here. I'm gonna open up the curtain. I'm gonna take this and just wrap it. And then we're gonna come over to the sink. All right, we're going to get a barrier. Put that down. Maybe. We'll set this on our barrier. On the right side is our CCs. That's where we want to measure. These go in, 25 increments. You have to get to eye level. And you want to be as close as possible in amounts. So I want you to come up here and take a look at that. Tell me, don't say out loud, just tell me what you think it is. I'll ask you as a group. You think that we are automatic fail, that's infection control. We're gonna take our clean paper towel, turn our faucet on, we're gonna hold on to that, we're gonna rinse, dump, rinse, dump. We're gonna turn this off with our paper towel. And this is not considered clean, so we'll get a paper towel to hold it. Paper towel to dry out the inside. We will throw that away. Grab another paper towel to clean off the outside. Throw that away. I'm gonna grab my pad. I'm gonna go over. Clean the houses. And push this back. First thing that you're gonna take off, we take off inside of the room. So we're gonna take off our gloves first, because this is the most contaminated. We're going to untie at the bottom first. Then we're gonna untie at the top. We're gonna take our strings and bring them forward. We're going to grab a hold to this string, pull that out. Grab a hold to this string, pull that out, and it's gonna turn it inside out. We will put it in the hamper, unless it's a plastic or a paper one that throw away. And then you'll go over to the sink and wash your hands, and then you'll say skill complete.
Which one is this one?
That pan.
My name is Tasha. I'm gonna be your nurse.
I don't know.
I'm just gonna teach you what you're gonna do. Is that okay? Alright. Hurry, I gotta pee. Okay, well, here's your call light while I get my supplies. Alright, and I'm just going to wash your bed at the top and the bottom, and then I'll be right back with your supplies. You're gonna need a pad for the table. You're gonna need a second pad. Go up underneath her. You're gonna need our bedpan. Hand wipes. Cylinder. Tissue. Okay? We're gonna need one washcloth. A privacy blanket. And we are also going to need our gloves. Now that I have everything that I need, I want to go ahead and take the towel light from you. Thank you. I'll put this right up underneath your pillow here. And I'm going to let your bed up. Now I'm gonna go ahead and put my gloves on. Okay, Miss Betty, we have this privacy blanket here for you. It's just gonna keep you covered while I put you on this bed here. Hope you're not allergic to bleach. No. Okay. for me. And then I'm gonna have you raise your butt, your bottom on the count of 3. 1, 2, 3. Okay, go ahead and lower your bottom, then I'm gonna go around to the other side. I'm gonna have you do the same thing on the count of 3. 1, 2, 3. Alright, let it go down. Alright. Now I'm going to go ahead and place this bedpan up under you. Remember the wide side is for the buttocks. Alright, so I'm gonna have you raise your hips on the count of 3. 1, 2, 3. And go ahead and lower it down. How's that? Do I need to move it over some?
Yeah,
To my way?
the other way.
Okay?
Yeah.
Okay. Alright. Alright, so I'm going to hand you your call light. And I'm gonna adjust your head. You tell me when to stop. You should fall down into the bed here.
It just spilled because I didn't have you positioned right.
So is that good with your head?
Yeah.
Okay, and then because I have to walk away from you, I'm gonna lower this bed some. I'm going to place this table by you, so you can have your tissue. And I'm just gonna be right behind the curtain if you need anything. Let me know when you're done,
I'm done.
okay? Alright, while she's still sitting on the bedpan, I'm gonna take this from you. Would you like to wash your hands? So they act like she wiped herself, basically. Okay, then I'll have you dry your hands. Thank you. Alright. So now I'm gonna go ahead and lower the head of your bed. I'm gonna raise the bed back up to working position. Okay. And so if this is the real world, you will put the bedpan right to the floor, but for state testing, it's gonna be covered. And it'll be sitting here. We're gonna pull the pad out with it. Alright, so I'm gonna have you bend your knees for me again, please. And then I'm gonna have you lift your hips on the count of 3. 1, 2, and 3. I'm gonna take that with the pad, okay? Remember, we want to get her together first, so we roll, pull, roll, pull. Is there anything else that I can get you? Alright, well, here's your call light. I'm gonna go ahead and lower your bed. I'm gonna open your curtain. And I'm gonna have you get up so you can go and see what I'm getting ready to do. So we're gonna take our bedpan, and we're gonna take our cylinder, and we're gonna come back over here to the sink. And we're just going to set this right on top of this commode. We're gonna take a paper towel, and we're going to set that there. We're just gonna open this up. Gonna open this up. The observer would then pour some urine in here for you to measure. So you would then take your bedpan and pour the contents in here. And just set it right back on top here. Be quiet. And so we will get our results. It's 175. I will write that on that paper, right? So that was one thing I forgot to show you. When we had that over here for the empty the catheter, you would have wrote 95 on your paper. Okay? So you would write 175 on your paper. Now that you have written that on your paper, you're just gonna dump it right back in here to overthink it. You don't have to lift that commode up yet. We're gonna take a paper towel and turn on our faucet. We can go ahead and throw this away because it's gonna be a minute before we, need to shut that off. Rinse. Dump. Rinse. Dump. Take a towel to hold it. Take a towel to dry out the inside. Just throw that away. And take a towel to dry out the outside. Throw that away. And then we will grab a clean paper towel to set this on. Leaving this on there. Alright, so now we have to clean out our bedpan the same way we clean out everything else. Just move this over to the side. We're gonna dump this in here. We're gonna rinse. Dump. Rinse. Dump. Same thing. Paper towel. Hold it. Grab the inside. Throw it away. Grab another one. Grab the bottom. Throw that away. Grab another one. And shut this off. We want to take this, put it in here. We just want to grab our pad and take it back over there. We're going to use this paper towel to pick up our supplies. Step back. Alright, this is a hand washing skill. I'll just take my gloves off, hand wash, and say skill completed.
Okay. I love those ones.
I have.
So the terminator is John.
Are you terminated? You can't walk.
Alright.
He's amputated?
He ended up all messed up after trying to help Sarah survive.
That's the tell.
Mm-hmm. My leg ain't legging.
So I don't know about that. Alright. So this is, we're gonna do foot care.
Okay.
So you can go ahead and find that. Page 12.
Thank you.
Okay, so my knot, sanitize. Hi John, my name's Natasha, I'm gonna be a nursing assistant today. I'm here to do some foot care on you, is that okay? Alright, well here's your call out if you need anything. I'm gonna go ahead and lock your wheels. And then I'll be back with your supplies. Okay. We're going to take our pad. And we're going to place it right up under his foot. Then we're going to get the rest of this. We're going to get our basin, our soap. We're going to get lotion. We're going to need 2 washcloths, 1 big towel, and 1 sock. We're just gonna bring those things right over here. I'll be quiet. Everything has to stay on. Wow, okay. Everything has to stay on this, pad. Oh, I need gloves, I'm sorry. Correction, I would have had some gloves. You still don't put them on yet, it's the same as if you were at the table. Alright, John, I'm gonna go ahead and get you some water, then I'll be right back. I'm gonna go to the sink, grab my paper towel, turn my water on. Check it, fill this up halfway or less, turn off that same paper towel, come back. John, can you say that the water's okay? Alright. So, now we're gonna put our gloves on before we touch our person. So we're going to take our sock off, and then we're going to put his foot in the water. And we have to state, I will let his feet soak for 5 to 20 minutes. We don't actually sit here and do that. We just say we'll let it soak for 5 to 20 minutes. We're gonna take it out because remember, no soap in the water. So we'll take our first washcloth. This is not a leaf method. Squeeze it out, put a little soap on there, and we're just gonna wash his feet. No certain order, get in between the toes. Set this aside. We're going to rinse inside of the basin. Okay, take his foot out of the basin. We will dry his feet. And we're gonna take our washcloth and we're going to go in between the toes to dry. We're gonna take our lotion and we're gonna put it all over his toes except for where?
In between.
Okay, and then we're gonna pat off the excess amount of lotion that we do have on there. Then we're gonna put our sock on Mr. John, our clean sock. John, is there anything else that I can get for you? No? There's your call light. Correction, I'm gonna close my curtain when I first gave his call light and locked his wheel. Open it up. Go to the sink, paper towel, turn the faucet on. Dump this out, rinse, dump, turn off the same paper towel, just as clean. Grab it with a paper towel, dry the inside, throw it away, paper towel, dry the outside, throw it away. Paper towel, come back over here and pick this stuff up with. Put it back. Grab our pad, get rid of it. This is not a hand washing skill, so we'll take our gloves off. We're going to sanitize out. And our skill is complete. My name is Natasha. I'm going to be your nurse assistant today. I'm here to do some range of motion exercises for you. Is that okay? Alright, so I'm just gonna give you the call light here. And then I'm going to raise your bed. Nope, I wanna lock your bed at the top and the bottom. And correction for my bedpan, cause I don't think I locked the bed at the top and the bottom. I might have, but. So what we're gonna do is we're gonna do range of motion exercises to your shoulder. We're gonna do, I wanna bring your arm back and then back to the bed again, and we're gonna do that 3 times. You just need to tell me if you have any pain or discomfort, okay? So we're gonna take your hand and we're gonna turn your arm this way. We're gonna place our hand up underneath the elbow and up underneath the wrist, and you have to say the range of motions. So this would be flexion. Bring your body down some. Because have to pass the ear. So this would be flexion, extension. Any pain? Flexion, extension. Any pain? Flexion, extension. Any pain? All right. So we're gonna bring your arm out and then back into the bed again, okay? All right, same thing. Abduction, adduction. Any pain? Abduction, adduction. Still doing okay? Abduction, adduction. Any pain? All right. So that's all the range of motion exercise I have for you. Is there anything else I can get for you? All right, you would give her a call light, lower the bed, open the curtain, okay? So for the second one, you're gonna do the same, type of exercises. This would be a range of motion of the hip and knee. So you would place your hand up underneath her ankle and up underneath her knee, and then we'll do flexion. So we're gonna bend the leg, flexion, extension, any pain. Flexion, extension, you still doing okay? Flexion, extension, any pain. Alright, then we're gonna bring the leg out and then back in again. So, abduction, adduction, any pain? Abduction, adduction, still doing okay? Abduction, adduction, any pain? Alright, well here's your call light. Ready for your body to breathe? Alright, we're gonna go ahead and lower your bed. I'm gonna open up her curtain. I'm gonna sanitize out. And then I will say my skill is complete. Stay right there for me. And I will say my skill is complete, okay? So remember, those are two separate skills, yes.
On the paper, it says you do abduction and adduction first, so does that matter or?
How I show you.
Oh, okay.
Remember, those are universal.
Oh, okay, so
How I show you. I know which ones go first because I'm an observer, so just do it the way I showed you, okay? Alright, so, the next two are the same. You know how those were similar, but they're two separate skills?
Yeah.
So I'm gonna show you how to transfer from the bed to the wheelchair, and then you would ambulate. What does ambulate mean?
Walk.
You will ambulate to the wheelchair. So those are two separate skills, but how you start them both are the exact same. So the only thing that you're doing is different is transferring and walking. So getting my supplies, part of getting my supplies is getting my wheelchair, making sure I have my call light, and I'm just gonna lock the bed, lock the chair, okay? I don't wanna bring it all the way up because I don't want to hit her legs, her feet when I transfer it over. I'm gonna just set your phone right here. And I'm gonna go ahead and, call light. You want to raise the bed based on the person's height. So I'm just gonna raise the bed, not that high. You wanna make sure that she's able to touch the floor. Okay, so the first thing I'm gonna do is I'm gonna assist you with scooting towards me, okay? So we're gonna start with the top, middle, and then bottom, okay? So I'm gonna move you towards me on the count of three, your top part, 1, 2, 3. So you help me though. And then bottom, 1, 2, 3. And then this part, 1, 2, 3. Okay? Alright. And then what I'm gonna do is I'm going to put your shoes on you.
Man, put her real quick. That's some big old
Okay,
shoes.
Alright, and then so what we're gonna do is we're gonna turn you to sit you on the side of the bed, and we're gonna dangle you, okay? Yes, so I'm gonna put my arm behind your shoulders and across your knees, and then I'm gonna turn you, okay? Okay. And then, so on the count of 3, 1, 2, 3. Alright, are you feeling lightheaded or dizzy at all?
Yeah.
Okay, we'll see you for a second. And push your legs back for me. Okay. So I'm gonna go ahead now and pull this up. I'm gonna get my gate belt. Alright, so if you've never used the gate belt before, on here we have these little things that we call teeth, okay? So you always want your belt to go through there. So I'm gonna take this, I'm gonna push it through here, and this where the teeth should be grabbing onto there. Once we figure out how tight we want the belt, we'll then go ahead and loop it again through there, okay, and it'll stay. Alright, so what I'm gonna do is, move it there for me. Alright, I'm gonna have her raise her hands for me. I'm just going to put this around her waist. Then I'm going to do exactly how I said, put that in there. It should be, the teeth should be grabbing it. And you want to tighten this, making sure that you can get at least 4 fingers under there. Is that okay? Alright, and then we're just going to make sure that it's nice and snug. I feel like you can go in a little bit more. Okay? Because you want to make sure that it fits, because if you don't, some of these ladies are small like her, probably a little bit smaller. And so if you take that and it's not tight enough, it's just gonna come straight up. Okay, and then she can fall. So I'm gonna have you put your legs together for me. I'm gonna put my foot in front of her foot the way we're gonna turn, so that my body is gonna be forced to turn that way instead of just twisting. Okay, so I'm gonna have you put your hands on my shoulder. And we're gonna rock 3 times. And every time you rock, you should be coming up off the bed more. So 1, 2, 3. I didn't want to sit you on this. Are you feeling okay? Mm-hmm. All right. So we're going to then, her back, make sure her back is up against the chair. That is a check mark. We're gonna go ahead and take this belt off of her. We're not gonna just slide it, we're gonna have her sit up, and we're gonna actually take it from around her. Okay, we're gonna sit back. Alright, we're going to unlock her chair. We're gonna give her her call light here. Is there anything else that I can get for you? Alright, we're gonna open up our curtain. She just stays there. In the scenario, say you don't need any wheelchair pedals, we raise the bed, so we have to lower the bed. Once she's done with that, you'll sanitize out, and your skill is complete. Okay? Sit back on the edge of the bed for me really quick. Here to the bed. So when it's time for us to get our supplies, instead of bringing it there, we're gonna bring it here for ambulation. They have to walk at least 10 steps to the wheelchair, okay? So everything that I did to get her up on the side of the bed, it'll be the same thing you'll do for ambulating, okay? Yes, y'all with me? Okay. So you would lock her wheelchair, grab your gate belt and take it over to the bed, and then get started with, you know, raising the bed, position her towards you, and then turn her to the side of the bed. So let's say we have our gate belt. I'm not gonna put it back on. We'll put our gate belt on her, okay? So this time we don't have to rock her because she's standing straight up. So we'll totally put her, put your feet together. We still will put our foot in front of her feet, have her put her hands up here. I will hold on to that gate belt on the count of 3. We have you stand. 1, 2, 3. Okay? You feeling lightheaded or dizzy? No. Okay, so we'll have her drop her arm. And so we will have the gate belt right here on the side, and we'll have it in the back, and we'll have her start to walk over to the chair slowly. All right, are you ready? Mm-hmm. All right. 1, 2, 3. towards me. And then we're gonna turn one more time. And I'm gonna have you back up until your legs touch the chair.
If you can.
Alright, and so what I want you to do now is to reach for your armrest on the chair. And then we're gonna sit on the count of 3. 1, 2, 3. Okay, doing okay? Alright, take off her gait belt, have her sit up, take that out of there. Unlock her wheelchair, put her gait belt back, give her her call light. You would go back and lower her bed back down, open the curtain, sanitize out, and then the skill will be complete. Okay?
Mouth care, you already told us.
Mouth care.
14.
Which page is that on?
14.
Oh, thank you, girl. Thank you.
So this is mouth care. Hi, Miss Sarah. My name is Hi, Miss Sarah. My name is Tasha. I am your nursing assistant today. I will be doing mouth care on you. Is that okay? All right. So here's your call back if you need anything. We're gonna go ahead and lock my brakes at the top and bottom. And I'll be right back. So, of course, we need a barrier for our table. Yeah. We're gonna need, this is mouth care, so we're going to need an emesis basin, we're gonna need toothpaste. On state testing day, you would use the ones that's in a plastic because it would brush someone's teeth through. So right now, I'm just gonna use the ones that's open. We will need a clothing protector. We're gonna need a cup. And then we're gonna need some gloves. Okay, Miss Sarah, I'm gonna go and get you some water. I'll be right back. So I'm gonna go to the sink. I'm gonna grab a paper towel, turn it on. I'm just gonna make sure the water is cool. Put some cool water in here. Shut it off. She doesn't have to test it. I'll bring it back. Now I have everything that I need. So I'm gonna go ahead and raise her bed. You wanna raise it to a 90 degrees, so that's gonna raise it up until it stops. All right, Miss Sarah, I'm gonna go ahead and raise your bed.
You just called that baby ugly.
All right, Miss Sarah, would
You
you
know
like a
what?
clothing protector? We have to ask her, would she like a clothing protector? So if the clothing protectors aren't there, you can always use a big towel.
I think it's just her wig.
All right, Miss Sarah, I'm gonna go ahead and put my gloves on so we can get started. I have to buy some nitrile gloves. Okay, all right, so once you get your gloves on, you want to open up your toothbrush out of the plastic. You would dump your toothpaste in there. You will take this off, put some toothpaste on there, and then you will go ahead and get started. So there is a way that you do this. So you're gonna say, okay, Miss Sarah, we're getting started. You're gonna say, I will brush the top outer, the top inner, and the top chewing surface. Okay? Then the same for the bottom outer, bottom inner, and then the chewing surface. Would you like to spit? Okay. I'll go ahead and use some water first. Alright, so we're going to brush top outer, top inner, top chewing surface. Then same for the bottom, outer, inner, and then chewing surface. Here's some water. can you put your teeth together for me, please? Alright, we're gonna brush the fronts of our teeth. And then can you stick your tongue out for me, please? Okay. Okay. Is there anything else that I can put in here? No? Here's Paul out of anything. Open up our curtain. We'll take this water and we'll pour it in here. This toothbrush and this cup will be disposable. We'll take this over to the sink. We'll grab a paper towel, turn that faucet on, we'll drop this in there. We have to throw that paper towel away because we have to rinse, dump, put a little soap in there, clean that out, rinse, dump, grab a paper towel, shut that off, grab a paper towel, hold it. Paper towel to dry the inside, throw it away, paper towel to dry the outside, throw it away. Grab one more paper towel to pick this up with, put it back. You would put that in here if you're doing someone's real teeth, and throw this all in the trash. Okay? We'll take off our gloves. This is not a hand washing skill, so we will sanitize out. And then our skill will be complete. Okay?
This is denture care, right?
It's on page 7.
And I'm just gonna come right over here to the sink.
I'm just recording.
So one of your washcloths are your barrier. You're gonna set everything on this barrier. This washcloth goes inside of the sink, and so this will fall off. You're gonna take everything out and set it on here. We're gonna take a paper towel, and we have to state, we're putting this on cool water. We're gonna prepare our brush first. We're gonna take our brush, and we're just gonna wet both sides, no shaking or flicking it. Okay. We'll take our toothpaste. We'll put a little bit of toothpaste on this side, and a little toothpaste on this side. Okay. We're just gonna set this toothbrush in here. We're gonna take our dentures, and we're gonna pour the water out. Should have been more than that, and then we're gonna rinse out our cup. And we'll just put some more water back in there, set it in our basin. Barrier, sorry. And then we're going to start to brush the teeth. Doesn't matter where you start. And then we're gonna take this smaller side and go through here. And we'll flip it and use it to go inside of our rim. Okay. We're going to take our toothbrush and rinse it out. Just squeeze out the bristles and then set it back on our barrier. Then we're gonna take this, we're gonna need both our hands to kind of make sure we get all that toothpaste off of these dentures. No shaking. And we'll just set them back inside of here. Okay. We're gonna clean out our Nemesis basin. Take a paper towel to hold it. Paper towel to dry out the inside. Throw it away. Paper towel outside. Throw it away. take a towel and turn off our faucet. Throw that away. You need a paper towel to pick this up. Put this stuff back in here. Put that in here. We'll throw that away. Squeeze our towel. Our washcloth, I'm sorry. You will take this, both of these back over there, but I'm just gonna put this here. So we'll grab them, bring them back. We'll take off our gloves. Miss Sarah, is there anything else that I can get for you? Alright, you can call out if you need anything. Size out. Alright, antibiotic stocking is the first actual skill, the first on the paper, the first skill in your phone, in your packet. Hi, Miss Sarah. My name is Tasha. I'll be your nursing assistant today. I'm here to put on your antibiotic stocking. Is that okay? Here's your call out. Please log in my supplies. I'm gonna lock your bed at the top and the bottom, and I'll be right back. I'm gonna go ahead and put my gloves on. Grab my antibiotic stocking. Okay, so antibiotic stockings come in there's three different types of antibiotic stockings. You have these where this goes across the toes. You will have it where the hole goes behind the toes, and then you have it where the hole is straight across the top of the toes. Okay, so for here you will have the one where it goes right across the toes. Okay, all right, Miss Sarah, we're gonna go ahead and get started. I'm going to raise your bed. Always one side, so we would just pull her leg out from underneath the blanket. Okay. So I'm gonna have you, if it doesn't tell you in the scenario, then no. I'm gonna have you guys come up here. So you're gonna put your hand through here, because you're getting ready to do this. You're gonna put your hand through here. So this would be considered as top of the toes, okay? Once you do that, you're gonna bring this, it's gonna fold it halfway. But you wanna bring it just beneath this yellow part, okay? Then we're gonna grab both of them and pull our hands out. This cannot be wrinkled up for any reason. We're gonna take 4 fingers. This yellow should be facing us. We're gonna take 4 fingers and put it 4 fingers on both sides. Now, when you're putting your hands in here, you have to make sure you're holding it still so that yellow part doesn't move on you and make your TED holes crooked when you put it on, okay? All right, so we're gonna take that, we're gonna spread it as wide as we can, put this on, okay? We're gonna use our thumbs to help pull that down. Then we're gonna just get this and put it underneath the heel. Okay. Then we will pull this back. My nails a little bit longer than I usually have. Okay, you cannot have any wrinkles in the sock. And then that's it. You put this back over her, let her bed down. Okay, so you don't have to take these back off, but when you do take them off, the easier way to do it is to just bring it straight down. Then grab this under the heel and take it off, okay? So what you see people usually doing with these is they'll ball them up like this, okay? And when they ball them up like this to put them on, it makes this so tight that they can't spread it to get the feet on, to get the foot on. Hi, Miss Sarah. My name is Natasha. I'm going to be a nursing assistant today. I'm here to assist you with feeding. Is that okay? Right here's your call light while I get my supplies. I'm going to go ahead and lock your bed at the top and the bottom, and I'll be right back. For this skill, you do not need a pad for the table. On your tray, you should have 1 8-ounce glass, 1 4-ounce glass for here in Michigan, a napkin, a spoon, whatever your person is going to eat, some hand wipes, 1 washcloth to dry, and you should have a tray ticket on here as well. You cannot stand to feed anyone, and you do not need gloves to feed anyone. So this won't be here. This is part of getting your supplies, okay? And we're gonna need a clothing protector. Now that we have everything that we need, we can go ahead and raise the bed. And we're going to just set her up at a 90-degree angle. Would you like a clothing protector? Can you state your name for me, please? Sarah Jones, okay. Would you like me to wash your hands? You would wash both hands. And then you're going to throw that away, then you want to dry. Okay, Miss Sarah. Today you have water, applesauce, and apple juice. What would you like to start with? With a sip of water? Okay. What would you like now? Okay, some of your applesauce. When you scrape off from the top, you usually get a big spoonful. You don't go down because it'd be hard to measure how much you have eaten, okay? So you want to scrape straight off of the top. A nice full big spoonful would be at least 10%, okay? How is that? Good. Like another bite. Scrape again. Okay, you would like some apple juice. Well, that must be pretty good. Would you like some more? Oh, you want some more to eat, okay. One more spoonful. Okay. And you want some more? That will be all. Okay. Let me wipe your mouth. And we're going to wash your hands again. I'm just going to dry them. Okay, and I'll take this from you. Okay, Miss Sarah, I'm going to leave you sitting up at a 45-degree angle for 30 minutes. And that's just half of where you were at. And lower the bed back down. And is there anything else that I can do for you, Miss Sarah? No? All right, well, here's your call light if you need anything. So you'll have your paper that they give you and you want to do your calculations. So it'll have intake, which will be in percentage. So how much did she have in food?
50%.
She had four, she had 4 spoons full. So that'd be how much?
40%.
So we write 40% on there. And so her 4-ounce glass was water. I'll say she had 75% of that. So she had how much in milliliters or cc's?
90.
She had 90. So for glass 1, you would have 90. And then she has 75% for her 8-ounce glass. How much is that?
270.
She had 180. So we'll add 180 to her 90, which will give us what? 270. 270. And so your total will be 270 with the glasses. And then once you're done, you're just gonna put your tray back here. And then you would sanitize out. And then your skill will be complete. Okay.
I found it.
So remember, you have to say start.
I'll start 4. And start.
Thank you.
I got 67.
I got 64.
You can only be 4 off. So go ahead and go into respirations.
And we'll start at 8. And start. Wait, I have a question.
That messed us up.
My bad. My bad, y'all. Sorry.
I gotta start over.
Okay, I'll start at 3. And start.
16.
Go ahead and close out,
What?
finish it.
Do I have to write it down when I do that?
Mhm.
Okay. I'm gonna go ahead and lower your bed for you. Here is your call light. Do you need anything else? Yep, I'm good. Okay. I'll sanitize it.
Yes, it's still complete.
Still complete.
I'm gonna have you assist me to move you towards the edge of the bed, okay?
Okay.
So we'll start with your first part first.
Okay.
We're gonna move 1, 2, 3. 1, 2, 3. And 1, 2, 3. Okay, and then I'm gonna position you to turn. So I'm going to place your arm here across your chest, and I'm gonna just place that one back onto your pillow. I'm going to flex your knee, okay? And then this knee, I want flex outward. So like this, okay? And then this is when you will call up your observer to come and stand on that side when you turn, okay? So the observer come up and we would have you turn on the count of 3. We'll have you turn towards the observer.
Okay.
So 1, 2, and 3. Okay. And then your first pillow is gonna go behind your back, and we're just going to tuck this pillow behind your back, and then we're gonna kind of roll it over like a hot dog bun, and we're going to tuck it again. Okay. Then we're gonna take your next pillow and we're gonna put it between your knees. And that's going to go the same direction that your knees are facing. Then I'm gonna walk around. And I'm gonna place this right up underneath your armpit, the same way your arm is laying, okay? You always wanna make sure that the pillow that you're laying on is above your shoulders. So I'm gonna have you lift your head for me just a little bit, and I'm just going to position your pillow up, okay? And then your hand that was on top of the pillow, I'm just gonna put it underneath your pillow. And you're doing okay?
I'm doing good.
All right. All right, so I'm going to hand you your call light into your hand here, maybe. It's stuck, so if I can see your hand, okay. All right, is there anything else that I can get for you?
No.
All right, so I'm gonna go ahead and lower your bed down. Okay, and I'm going to get rid of the hat that was on the table. Open up my privacy curtain. I want to sanitize out. And my skill is complete. So if you want to see how